Okay, so here are a couple of statistics that we did not get to go over. So, boys account for 71% of all school suspensions, and suspended at least once during their school career. 59% of African American boys actually have been suspended at least once during their school career, in comparison to 42% of Latino boys. And this again is according to the U.S. Department of Education. Additionally, boys comprise 66% of all special education students, and almost 80% of these are African American and Latino males. Again, this is information that has been collected by the U.S. Department of Education. Lastly, boys are 5 times more likely than girls to be classified as hyperactive. And this is actually from the National Center for Education Statistics, where I got the other data, which disaggregated based on emotional challenges and race of the student. So there's a phenomenon that we call the missing boys, and basically what it boils down to is how schools are failing boys. And so we have noticed in research that students, especially boys, are 30% more likely to drop out of school if they are struggling in those early years. They are lagging in reading, and of course, the gap widens the older they get. If they study less, they hand in less homework, their GPA also decreases, and there is concurrent acting out behaviors. That is when putting all those pieces together contributes to that percentage of 30%, where we are going to lose boys to dropping out, because if they're struggling, they don't want to be in school and being embarrassed. And so we kind of talked about this a little bit in terms of what comes first, the chicken or the egg, but I want to put it into kind of a slightly different context and pose the question to you all. Would you rather be the dumb kid in class, or would you rather be the bad one, and why? So those are some things to kind of think about. If you are interested in more about how school systems are not set up to really help our boys thrive, then this would be a really good read for you. And it's The Trouble with Boys. And I really, really highly recommend it. It's a really good read. Okay. We are not going to do the Jamboard. But I do want to cover acting out versus withdrawn. So with acting out behaviors, what we notice is that it is definitely more common in boys, and it is very visible. However, because of that, it does tend to be over identified, and it is identified earlier within their school careers. It is often, again, associated with poor school performance, which are kind of like the characteristics that I discussed in the previous slide. Usually, we address it with a behavior plan. And ADHD might be misdiagnosed as an emotional behavior disorder or challenge. When we look at withdrawn behaviors, we do see some differences. Withdrawn behaviors are actually more common in girls, and because they don't get a lot of attention, they're often more invisible, they're difficult to observe, and they may be tended to be under identified. But eventually, it might come to light, and it may be addressed. Withdrawn behaviors, really important to point out that they're often associated with anxiety, and sometimes they are addressed through a referral for mental health services. I just want you to kind of just let this, you know, sit in for a bit and just kind of look at the differences of acting out behaviors versus withdrawn behaviors, and the type of quote unquote treatment they get in terms of being able to address them. Okay, so let's take a look at what are some signs of acting out behavior. Well, Some of the most common ones include tantrums, defiance, lying, bullying to others. Could also include self injury, such as cutting oneself or headbanging, alcohol or drug abuse, truancy, running away, participating in unsafe sexual activities, getting into fights, assaults. I mean, the list goes on and on and on in terms of what are the signs of that acting out behavior. Signs of withdrawn behavior, on the other hand, includes absenteeism from school or school avoidance, um, presenting a lack of agency, perhaps experiencing low self esteem or self worth, which contributes also to or goes hand in hand with poor school performance. And again, as I stated previously, anxiety oftentimes it exists concurrently with the withdrawn behaviors that we see. There may also be some self harming being done by the student, as well as suicidal ideation. So, as a quick reminder, I just want to circle back to the student study team or the student success team. And just as a quick reminder, that an SST is a part of general education. You might be asked as a resource teacher, mild moderate teacher, to serve on an SST. As an ed therapist, you might be asked to come to the meeting so you can provide your input and insight in terms of supporting the student. But please remember that the functions of the SST are the following: to make it work in the general education setting, if at all possible, before we even start considering a referral for special education assessment. Again, the function of an SST is to reduce the number of special education assessments. And another function of it is to give general education suggestions on how to better support all students. I repeat, the SST is not meant to be a gateway to special education services, though sometimes it may operate that way. An SST is meant to be proactive and not wait to react until the student fails. Okay? So, up to now, we are with the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders. And this is actually the holy grail. This is the manual of all mental disorders that psychiatrists use to be able to find to diagnose students, and to also prescribe medication. It provides best practices for treatment. And so it is used in schools, but it doesn't need to match exactly what we're seeing in school in terms of a mental disorder versus how it might be manifesting somewhere else. One really important point to consider is that there are differences in the way that our federal law of IDEA defines mental disorders, as opposed to the American Psychiatric Association. So, something really interesting to point out. Okay, so let's go ahead and look at what is oppositional defiance disorder. So, oppositional defiance disorder is a condition that involves recognizable and negative behavioral patterns, an overall negative or agitated mood, a quarrelsome attitude, or being vengeful for at least 6 months. So, what does that mean and how does it play with this? Well, what we often see with students that are diagnosed as having an oppositional defiance disorder is that they often lose their temper quickly. They're very easily agitated. They often express anger and resentment. The child becomes very argumentative to anyone with authority. The child may purposely disobey established rules, and they might also cause commotions or partake in disruptive behavior. And they may also lay blame on others. Now, again, all of these behaviors have to be in place for at least 6 months before a diagnosis of oppositional defiance disorder, which again falls under the EBD umbrella, is considered. Okay. Conduct disorder, on the other hand, is a continual pattern of aggression towards others as well as intentional rule breaking behavior. So, a conduct disorder is also a childhood behavior disorder, like an oppositional defiant disorder. However, the DSM 5 characterizes a conduct disorder as a condition where a child intentionally violates rules and the rights of others. And I know it's difficult to kind of figure out, wait, conduct disorder and oppositional defiance disorder, they sound very similar, but I'm gonna in the next slide show you how they actually differ. So, some common conduct disorder signs and symptoms, it can include expressing aggressive behaviors, initiating fights, using a weapon to injure people or animals, past instances of physical cruelty to people and or animals, directly stealing property from victims, intentionally causing fires, or breaking into another person's private property. All of these can be exhibited and symptoms of a conduct disorder. So, albeit in different ways. So, control for both in oppositional defiant disorder and in conduct disorder um, plays a huge role. However, again, a child with oppositional defiant disorder, they do not like being controlled by society or those that they love. And a child with a conduct disorder, in addition to not being or liking being controlled, will also try to inflict that control on others. And again, either consciously or subconsciously. Okay? So, how do we identify a treatment plan? How do we support students with oppositional defiant disorder or conduct disorder? How do we provide them support? Well, there's two ways. One is by using a functional behavior analysis, or FBA for short, and the other is a functional analysis, an FAA. So an FBA is actually less formal, and this is what all of you mild moderate teachers that are going to be teaching in public schools will more than likely be part of, because it is definitely mainly conducted by the teacher or the case manager. Whereas the functional analysis is definitely much more formal, and it does include an FBA component. However, it is often conducted by a school psychologist, a behavior interventionist, or a program specialist. So it definitely is much more robust than an FBA. So, a functional behavior analysis, again, the one that many of you getting your mild moderate credential will probably be engaged in. The whole point of it is to identify a specific or target behavior that interferes with a student's education. So, the assessment attempts to designate the particular behavior, identify the factors that support the behavior, and determine the purpose of that behavior. Okay, and again, it's mainly conducted by the teacher, but a school psychologist or anyone else on staff can also conduct it. There is definitely an extensive review of previous data. There's also interviews. We are really interested in hearing from the parents or caregivers, the teachers, or the students themselves in terms of how they view their behavior. And we also use what we call an ABC chart, and I'm going to show you what that is to track the data that we're seeing, categorize it, and then try to look for some patterns in terms of when is the student most likely to exhibit challenging behaviors and when are they least likely, and we use that to inform our behavior goals. Okay, a functional analysis, which we said it is a little more robust. It does involve testing how certain changes impact the occurrence of the problem behavior, and FA is the only way to know for sure what causes the behavior. It does test one variable at a time. So if we're testing attention, so I'm just giving you an example, there will be nothing in the room except a person. We will only talk to the child when they engage in the behavior we are testing. That way, we find out if behavior might function to gain attention. We repeat these tests multiple times until we have stable results that make us confident behavior is most likely to occur when certain things happen. So, as you can see, it is very in depth. It is um, really untangling the environment aside from the behavior to really get an in-depth look at in terms of what is the function of that behavior. So there's four different types of functions that behaviors will go ahead and occur. So this is, I know you all know this, so this is a really quick review. So attention can be to get positive or negative attention. And so when that is occurring, it's really important that as part of your behavior plan, you introduce an alternative behavior for the student to get the same level of attention. That's really, really important. Sometimes the function of a behavior will be to escape an unfavorable situation or task. So it's really important that you know your student and you know what are their areas of interest and also what they might struggle with, because it could be that what they're struggling with is something that is very difficult for them to complete. It also includes tangibles. Students will engage in challenging behavior because they want something, and it could be either food, toys, whatever it may be. And so, again, I keep going back to introducing an alternative behavior for each one of these because when a student is engaging in challenging behavior to get a toy or get the iPad or whatever it may be, we don't want to ignore the behavior, but we want to shape it in such a way that we show the students that if they ask for it or they use a picture to request what they're asking for, that it will be honored. And therefore engaging in challenging behavior to get that one thing is not necessary, because guess what, we just found something else that will still get you that tangible. So it's really important for all of these to ensure that we are always, as part of our behavior plan, as part of our IEP behavior goals, that we are always including what's going to be the alternative behavior in lieu of the challenging behavior. Finally, there's that sensory function of behavior where sometimes a student will engage in sensory seeking behaviors because it is fulfilling some type of aspect of their body or whatever it may be. So it's really important to identify what is that sensory feeling that they're engaging in, and also show them more appropriate ways to get that need met as opposed to engaging in challenging behavior. This is a quick infographic of just in general functional assessment methods. How do we gather this information? Well, it's really important that we conduct direct observation, that we also use interviews and questionnaires, and that we also, in some point, although it may not be as robust as an FA, that we also see and test out our hypotheses in terms of what is the function of the behavior, when and are they most likely to occur, when are they least likely to occur, and kind of just try to identify a pattern. Okay, so ABCs of behavior. So this is an ABC chart, and the A stands for antecedent. So what event or action occurred immediately before the behavior occurred. The B is for behavior, which is what did the student do, and the C is the consequence. So in other words, what actions or responses were immediately given following that challenging behavior. And so you just document. I would just be sitting in the back of the room, and I would just be typing into my ABC chart to try to really quickly, get a snapshot of that data.